Hi everybody, this is Mrs. Dallas and I am doing our presentation on substance use and abuse, talking all about different kinds of drugs, what they do to the body, and that should follow your notes in your packet almost exactly. How the body metabolizes drugs, okay? Once a drug is ingested or injected or enters the body in any way, shape, or form, it goes right into the bloodstream, and then from there it circulates throughout the whole body, from the brain, heart, lungs, and kind of all the way back throughout the bloodstream. As soon as it hits the brain, it's going to combine or attach to the receptors in the brain sites, and that is what actually causes the highs. A psychological dependence is when a person believes that they need the drug to feel good or function every single day. It's more of a mental thing, whereas a psychological dependence occurs when there's a chemical need for Hi guys, this is Mrs. Dulles, and I am going to do our notes on substance abuse. These should follow the notes in your packet exactly. How does the body metabolize drugs? This is a really great diagram to kind of show what the body does in order to break down drugs. But basically, as soon as a drug is ingested, whether that is taken by mouth or injected or absorbed, or snorted, it goes right into the bloodstream. From the bloodstream, the blood is going to carry that drug to the brain and other vital organs. What happens in the brain is that it's going to attach to those receptor sites, and that's what causes a high. Now, the body is also going to work to eliminate that drug, and that can happen depending on what kind of drug. The liver processes it. It digests and breaks down through the body, and it secretes it, in urine or poop or things like that. Alcohol's a little differently. You can actually breathe some of that out. That's why a breathalyzer works as well. All right, so there's two basic kinds of dependence that we talk about a drug dealer experiencing. The first is a psychological dependence, and that's when that person believes that they need the drug in order to function or feel good. That's a little bit different than a physiological dependence, okay? The physiological dependence is when your body, your cells need that drug to feel good every single day. Obviously, there's going to be a tolerance that breaks up for that drug. So that means that your body needs more and more of that drug to feel the same effects. So I always kind of use the example of alcohol. So I go home tonight and I have one drink of alcohol, whether that be a glass of wine or whatever, or a beer or, any alcoholic beverage. I have one of them. That produces some sort of high. I get an effect out of that. Well, if I go and do that over and over and over again, that one drink is not going to cause that buzz or that high that I am looking for. I have to have 2 drinks in order to get that buzz, or on down the line, 4, 5, 6 drinks to cause that same buzz that one drink initially caused for me. Okay, so my body, my cells are actually in need of this drug to stay healthy, to stay well. Now, you can also, therefore, if you have this tolerance building up and your cells are needing this, now, if I stop using this, I might experience withdrawal, or I probably, most definitely, will experience some form of withdrawal. And that's my body going into almost like a shock once the drug is withheld. And you can have flu-like symptoms depending on the drug, can be very, very severe. Delirium tremens is something that actually can happen where you shake or kind of hallucinate by not giving your body that drug anymore. So, consequences of drugs. So, physical, obviously going to be all of your major organs. Mental and emotional, you're going to not be able to be thinking correctly. You strain those values that we've been talking about, those beliefs. Social, you lose interaction with friendships or family members that you once loved and had a strong relationship, and you turn that now towards your people that you're hanging out with that are doing drugs, or the drug dealers that you've been working with, or even gangs or things like that. Legal consequences. Anytime we do any illegal substance, there can be a consequence legally, which includes any of these listed, but not being able to drive anymore, jail time, and much, much more. Now, how do people take drugs? First of all, you can literally ingest them. That would be an oral ingestion. I took a pill, or I drank it, or whatever. You can inject it, okay? So you can inject it into your veins or your muscles or fat. You can inhale it. So all of our inhalants are things that people inhale. And then suppositories is another one. Now, one that's not listed on here but should be is absorption. So there are some medicines, and think of like the nicotine patch, where you actually put it onto your body and it's absorbed through the skin. Illicit drugs. So those are illegal to have, possess, to use, to sell. There is no reason why a person should have illegal drugs, illicit drugs, okay? And obviously, factors putting students at risk for using these illicit drugs. Of course, we have family history and genetics. We know that there is a genetic component to make people more likely to experience addiction than other people who do not have that genetic component within their families. Same thing for like cancer. You have a cancer genetics that makes you more likely to experience cancer, heart disease, and things like that. Same idea. Parental attitudes and behaviors. If mom, dad, grandma, whoever uses alcohol, uses drugs, we might seem to think that it's a little bit more okay to do so. Our friends who use drugs, positive expectations are, there's so much to deal with every single day that I'm looking for a way to escape. Mental health problems. We also know that kids who are in college, the sororities, the fraternities, have a really, really heavy influence to use alcohol and certainly other drugs as a result. Okay, so how do we avoid these? Factors that influencing a student to avoid this would be your values, your morals. Maybe it's religion, maybe it's your spirituality, maybe it's an engagement in other things like athletics or family life or whatever. Preventing drug use and abuse, changing expectations of partying, engaging parents, are talking to our parents about substance use and abuse and getting their perspectives on it. Identifying our high-risk kids, those kids who are hanging out with people who already use drugs. We want to kind of target them and say, hey, there's a different alternative to our lifestyle. And also providing treatment programs for those students. All right, so there's some major classifications of drugs here that we talk about: stimulants, depressants, hallucinogens, and then narcotics and opioids. So those are pain relievers, and we're going to talk a little bit about each one of these. Some of these do have medical uses, even though they're going to cause that physical dependence. So stimulants are the first one. These are things that speed up the central nervous system. So common examples of these would be coffees, teas, pops, and nicotine, and there is some medical use. So here are some other ones that are not medically, or not like food type examples: cocaine, crack, amphetamines, methamphetamines, and tobacco products are all stimulants. That means it's going to increase the central nervous system, and so you might hear these referred to as speeds or uppers or things like that. Okay, as I'm bouncing here to meth, pictures of our meth addicts. Methamphetamines are things that are made in labs. These have no medical use at all. All of the other ones actually do, except crack. Cocaine certainly does. Remember, this is also can be a painkiller. Okay, so this has properties of our narcotics, and sometimes narcotics are even coupled underneath stimulants, almost as a subcategory instead of a standalone category. So kind of keep that in the back of your mind as well. So cocaine does have properties of pain relief. So in certain settings, like a person who might have severe pain, like cancer or major pains, they might need these derivatives of cocaine. Again, not our street cocaine, but like derivatives that would be medically appropriate to help deal with some pain. Um, and again, amphetamines certainly do have some medical uses. Crack is kind of that more potent. People have made that to be a little bit different. No medical use for that. Methamphetamines, no medical use. Tobacco, no medical use. But, methamphetamine's a pretty nasty drug. We are getting some, pretty major consequences as a result of the methamphetamines that have been kind of sweeping the nation right now. Always just think these are really interesting. A person should not go from looking like this and 10 years looking like this. That is all consequences of the drugs. All right, depressants are our next major drug category. These are complete opposites to the stimulants. They are depressants and they slow down the central nervous system. They cause muscles to relax. They relieve tension and worry. They cause drowsiness. Extreme uses can stop breathing and heart rate. You can die immediately from a depressant. Two depressants that are taken together cause a synergistic effect, which creates a bigger effect than if these medicines were taken or these drugs were taken alone. Examples would be, I am taking some sort of a depressant for a medical thing, and then I go and have some alcohol when I go out for dinner. Now that's a depressant, and my medicines I'm taking are depressants, and it has a bigger effect. I can actually die as a result of mixing those two depressants. Barbiturates, tranquilizers, GHB, Rohypnol, and alcohol. Now, when we create our drug chart, guys, some of these things like tranquilizers, GHB, Rohypnol, even though they are depressants, we kind of subcategorize these out as club drugs. So club drugs are often drugs that are used at raves or parties or events, and can also be used as date rape drugs. And why? Because they're depressants. So they make the person go unconscious or fall asleep or lose muscle control, and it allows that person to, the perpetrator, to take advantage and sexually assault the person they put that in their drink or, gave it to them without them knowing or whatever. Alcohol is also a depressant, and it's one of our most commonly abused drugs. Narcotics, again, I said a lot of times these are subcategories of stimulants, but these are used specifically to relieve pain. They're narcotics or opioids or opiates, okay? And they do come from the opium plant, the poppy plant, which is what you're probably thinking right now. And there's certain parts of that plant that they take and make certain opiates from. Medical uses to treat pain, suppress cough, alleviate diarrhea, and for sleep, certainly, or anesthesia. So if a person's going into surgery, they might use an opioid-based medicine to get them to go under and therefore allow them to be able to perform that surgery. Narcotics bind to the pain-killing sites in the brain. With consistent use, they literally block your body's natural endorphins, and so it has to rely on these painkillers then to ease all pain. So, for example, like when a person stops using opioid products, what happens is they feel these intense pains that go on in their bodies. Well, why is that happening? Because the brain cannot make any more endorphins. The endorphins are your natural answer to pain relief. Okay, some examples of these are heroin, morphine, codeine. If you've had any sort of like dental work, especially for like having your wisdom teeth out, you might have even prescribed like Tylenol with codeine. Again, like these are ways of relieving pain, and we just have to be careful that we are not becoming reliant on these. Okay, hallucinogens. These absolutely have no medical uses. They alter your moods, your thoughts, your perceptions, visions, hearing, smelling, touch. People often say that they can see music and they can taste colors, which sounds all great and wonderful until all of these hallucinations become scary and intense, and people will often kill themselves, literally jump out in front of moving cars or off bridges or hurt themselves to a point because of these scary hallucinations. They can last several hours to days, and very unpredictable. You can't say that this did this for me is going to do this for you as well. So these are really kind of scary drugs. So again, you see ketamine in here. I think you're going to see some other drugs that kind of have some properties of other things. PCP, ketamine, LSD, ecstasy, peyote, which is actually a part of a cactus. We should also say there's mushrooms that have hallucinogenic effects that are pretty common, or not very common, but people will talk about or refer to. Marijuana. Now, marijuana, it is not a clear-cut drug. It doesn't have properties of depressants or stimulants, or it has a little bit of everything. So it's almost in a category all by itself. The active ingredient, so what gets a person high, is THC. Okay, this is the psychoactive substance within marijuana. The physical effects you can see here causes like red eyes, the blood vessels in the eyes to burst. Dry mouth, increased appetite. So you guys know getting the munchies is a common after effect. Also can increase blood pressure or decrease blood pressure. Again, we don't know exactly how all of these work in everybody. It can also give a person mild muscle weakness. It can also, again, these have different effects. Some people can increase anxiety. In other people, you might hear them say it lowers my anxiety. Some people do get very bad paranoia when taking marijuana or any THC substance. We know that that's really common anymore, where they don't have to smoke weed. They can actually take the THC out, put it into a vape, or put it into an edible, and that's how they're getting THC. So understand that all of these side effects are from the THC and not the method. Just a little did you know here, many college students have false perceptions of how much their peers use marijuana. In recent studies, students estimate that 57.7% of their peers had used marijuana at least once in the past month, and that 22.3% use it daily. In fact, only 11.4% has used marijuana in the last month, and only 1.2% use it daily. Club drugs, okay? Sometimes you'll hear them referred to as designer drugs or club drugs. These are drugs that are often used at raves or at parties. Designer drugs because they are not like they were kind of invented. They sometimes have their own chemical formula that people might make at home. Things like ecstasy, GHB, Special K, ketamine is another word for that. I should have probably put the correct term, and Rohypnol. These are all meant to simulate hallucinogens, but again, designed for when you're at these parties where there's lights and music. It's all supposed to work together. Now, what's scary about these drugs is that they have major effects, guys, that they are not, good drugs. These throw people into death immediately. These also increase your body temperature and literally burn your insides out. The lack of water, if you're at a party, you might be drinking alcohol. These are very scary drugs. Again, also used a lot of the time for date rape. Or sexual assault, slipping these drugs into people's drinks or giving to them unintentionally or telling them there's something else and they're really this, is also a part of that. Now, inhalants are something that most people are like, oh, I didn't know you could do that. And my young people especially don't realize how scary inhalants can be. So this is when a person smells or huffs or takes in all these fumes from things like everyday things like spray paint or glue or paint thinner or varnish, things like that. They sniff it all in. Now what can happen is your body needs oxygen. Your brain needs oxygen to function. If I replace all the oxygen in my body with these chemicals, my body is literally suffocating, and I'm doing it to myself. So that's what happens. You can have immediate effects, and death and suffocation can immediately occur, in addition to, um, you know, like traumatic brain injury type things where you might become paralyzed. You could be in a vegetable state where you are unable to talk or walk or function like you normally do. Can be very, very scary. That's one that most people kind of laugh at, but has major serious consequences. Steroids is another one. This is a synthetic, so it's man-made substance, to be similar to the male sex hormone testosterone. People use this to increase muscles, but they can have some major side effects. Things like, for men, it would be increased breast tissue. It would be increased hair all over the body. Sorry, gentlemen, but it's also going to shrink testicles and not be able to have sperm present, and therefore have sex, or cause a pregnancy should you want to, or when you want to, you will not be able to have a baby. It can do horrible acne, rage. You might have heard of roid rage. That's because of steroids. For women, it decreases breast size, puts hair on their bodies, increases roid rage. I can't remember if I said acne for both men and women, and not just like, oh, I got a zit, I'll pop it and put medicine on it and call it a day. No, these are pits, acne pits, where it's cystic acne. It's the deep zits that you cannot pop and deal with. They often leave like pitted skin, very, very bad side effects. The rage and the anger and the inability to deal with emotions, for both men and women, are really, really serious consequences. Okay, medicines obviously are drugs too, so when we say drugs, immediately our brains go towards the negative. But almost all of these drugs, almost, not all of them, but a lot of them did come or start as a medicine first. So medicines are drugs that are used to prevent or treat a wide range of health problems, prevent diseases, fight infectious diseases. So those are things like your antibiotics, your antiviral medicines, your vaccines that you get. They help relieve pain. And they can help restore health or regulate body systems. Things like high blood pressure medicines would be an example of that. Promote health by preventing disease before they occur. Vaccines, your antitoxins, all of these do miracles in helping prevent the spreads of horrible viruses that we've now eradicated as a result of vaccines. Antibiotics are chemicals that destroy disease while leaving the patient unharmed. Antifungals, antivirals, antibiotics are good examples of this. Analgesics are pain relievers. So you've all probably taken one, like an aspirin. But we have to remember that they can still be dangerous. We need to take them correctly. You can see all the health effects that they can cause here. Maintain or restore health. So these are people with chronic illnesses that need these medicines daily. So DZ, I'm seeing I put in a medical abbreviation here, guys. DZ means disease, chronic disease. So those are your allergy medicines. I bet a lot of us are on those. Antidepressants, body regulating like your heart meds, or maybe you have or you are on insulin for diabetes. That would all be an example of this. Also, cancer treatment. Drugs that can cause side effects, just like any drug, which is an effect on the body other than the intended effect. Okay, so we have to kind of keep that in mind. Whether we are taking an aspirin that can have a side effect, or a major medicine that can also have a side effect. And again, that's other than what's intended. Medicines also produce different effects if they are taken with foods or drugs or alcohol. So an addictive interaction, or two meds taken together to produce a positive effect, and sometimes they will even prescribe them together because they know that they will get that specific effect. So doctors are very, in tune with what works best together. A synergistic effect is when two medicines or two drugs are taken together to produce a bigger effect. Okay, so we talked a little bit about that. About like when we take alcohol and a different depressant, if we take them both together, that can actually cause major effects where you stop breathing. Okay, so you have to be very careful. And that's also why we have to let our doctors know if I'm on this herbal medicine or I take this daily or I drink this much alcohol. They need to know all that so they can prevent these side effects. And I can't say it, guys. I'm sorry. It'll come back to me. I'm just brain dead at the moment. So two or more drugs. Antagonistic. There it is. I knew I'd get it. Okay, antagonistic effect is when two or more drugs are taken together and they cancel each other out. That means that they don't work. So again, doctors should know that. That's why we should also be getting our medicines at the same places. So we are, able to the pharmacies can run drug interactions. Medicine safety: before any drug goes out to the public, it goes through big FDA testing to determine whether it should be an over-the-counter medicine or a prescription. Over-the-counter literally means that you can buy this over the counter without having a drug prescription or a doctor's prescription. If you have a prescription, that means that the doctor says that you can use this, but you must follow these exact directions. You must take it with this sort of food or whatever. Here's the degree of safety. So you can kind of look through the chart here and decide. What we understand is that our over-the-counter medicines have a low level of abuse. Basically, the guidelines are pretty general, universal dosings for adults and for children, and they're pretty safe. But prescriptions are going to be much more specific on who can take them, when they can take them, how much they can take them, and guess what? They can be addicting. So a lot of drugs can actually be very addicting, even though we get them from the doctors. Here's a prescription label. If you need to pause this right now, you certainly can, but you can kind of start to read all of the really important things on this prescription label. Again, here's some information, and if you needed to stop it, that's just fine. Okay, use, misuse, and abuse. Okay, use is, and I'm going from the bottom up because I think use is the most important one that we need to know. If we take a medicine or, if we use something, so I'm even thinking like alcohol, can you use that correctly? Absolutely. Okay. We have said that you must be 21. You may have, a drink or so, depending on your gender, body weight. Where are you located? If you are not going to drink and drive, can you use alcohol responsibly? Sure. Okay. Other than that, we're talking about medicines. Use is taking that medicine correctly for its intended purpose. Abuse is using a drug with the purpose of getting high. My purpose, whether it be a prescription drug or a drug I buy off my friendly drug dealer on the side of the street, there is no such thing, but I could, if I use that drug to get high, I am abusing that drug. Misuse is a little bit more in that middle section. So misuse is considered taking a medicine or drug. So this one would be specifically a medicine. I shouldn't have said drug, but taking a medicine any way that it was intended, but you are not using it to get high. So my friend has the same ailment as I do, and so I'm going to let them borrow my medicine to treat what they have going on. Maybe I take too much or too little. I'm not following that prescription or direction label. I take somebody else's meds. All right. I discontinue use without telling my doctor. I take my medicines for a little longer, a little shorter than prescribed, or I'm mixing those medicines. That is considered drug misuse. All right, guys, I think I have gone through everything. You are done with this. For a bonus buck, if you come up and show me a sentence written at the bottom of your sheet that is a positive statement about you, something like, I am smart, or I am an amazing student, I will give you a bonus buck because I know you've listened to this. You've actually taken the time, which is amazing, to actually listen to it, and you've learned so much about drugs. Sorry, this one's a little long. hopefully you've broken this up into a couple different sessions so it wasn't so overwhelming. All right, guys, you have a great day. Be smart, make healthy choices. See you in the next video.